October being a Breast Cancer Awareness Month, we welcome you all in our today's exclusive interview on breast cancer awareness and prevention. Today, for this exclusive interview, we have one of the eminent senior medical oncologists, Dr. Professor Kalaichalvi, who has an experience of more than 35 years in this field and is working as a consultant senior medical oncologist at Apollo Hospital and Rai Memorial Hospital, Chennai. She has done her MD DM Medical Oncology from the prestigious Cancer Institute, Adair, Chennai, and holds a very good experience in treating all malignancies. As a professor, she is invited by other medical colleges for guest lectures and CME programs. She has published papers in national and international journals and has attended many national and international conferences during her oncology practice. We welcome you, Doctor, for this exclusive interview and thanks for sharing your valuable time with us today. What is breast cancer?
Any growth that occurs in the breast and it turns out to be malignant or proven by needle test or pathology test will be called as breast cancer. Breast cancer normally occurs in one breast. Rarely it can occur in both breasts, where the chances of getting both the breast is only 1%.
What are the risk factors of breast cancer?
The risk factors for developing breast cancer are multiple. They are multiple, which can be divided into modifiable and non-modifiable risk factors. In the modifiable risk factor, having children in less than 30 years of age, or at least avoiding the first childbirth after 35 years of age is good. And not breastfeeding also increases the risk factor for developing breast cancer. You have to breastfeed the child for at least 6 months. Breastfeeding beyond 6 months is considered to be protective against breast cancer. If a woman turns out to be obese or overweight, then that also increases the risk of breast cancer. So maintaining ideal weight and having a healthy diet also reduces the risk of breast cancer. Consuming alcohol and smoking increases the risk factor for increases the risk for developing breast cancer. Continuous night shifts in certain professions, like you're working in mines, factories, and nurses and software companies or BPOs, also is said to have some effect on developing breast cancer. Coming to the non-modifiable risk factors, being a female increases the risk of breast cancer, and aging also increases the risk of breast cancer. If you have a family history of breast cancer, then it increases the risk multiple times. Having an early menarche, that is menstrual cycle starting before the age of 12, and menopause after 55 years of age also increases the risk factor. If there is a male breast cancer in the family, father or brother suffered from breast cancer, then the woman also has an increased risk of developing breast cancer. If the woman is not having children, that is nulliparity, then the risk also increases for developing breast cancer. If the breasts are very dense during a mammographic examination, then probably they have more glandular tissue. The glandular tissue persists even during the aging. Usually after menopause, the breasts become less glandular and more fatty. But in the dense breast, you find the glands are persisting into menopause. They have an increased risk of breast cancer when you have a dense breast. Taller women also have increased risk of breast cancer because they can have genetic and hormonal factors playing a role in developing breast cancer.
What are the myths of breast cancer?
The common myth is that only a person with a family history will develop breast cancer. But usually only 5% of women with breast cancer will will have a family history. So they will develop breast cancer. But the rest 95% will not have any family history. So they still develop breast cancer. So no fooling around like thinking that only breast cancer occurs in the family. The second common myth is that I'm young and I have a healthy habit and I maintain a healthy weight, so I will not develop breast cancer. The young women also get breast cancer, and 50% of breast cancers in India occur in women between 30 and 50 years of age. So, young women also should be aware of breast cancer. Then the other myth is that mammogram detects all early breast cancers. It is not so. 30% of early breast cancer, very small ones, may not be detected by mammograms. So you should continue with the annual mammogram. The other myth is that early breast cancer, once treated, will not come back and 100% cure is there. But early breast cancers do get a good survival, but they can come back after 10 years also. So one should be aware that early breast cancers, even if treated after long interval, they can recur. Then once the treatment is over, they don't have to go back to the hospital. That is what people think. It is not so. They should keep in touch regularly in the first 5 years, like every 6 months, then once in a year for 10 years. And after that, they can go as and when it is required. So annual mammogram will be recommended even after 10 years if somebody had a breast cancer treatment, because it can recur even after long period. Next question. Women should look for a lump or a mass in the breast, any enlargement of the breast, any change in the size or shape of the breast, retraction of the nipple, or change in the nipple place, either getting upwards or downwards. Then there is some skin changes like redness, thickening, puckering, ulceration. All these things can be a sign of advanced disease. Then the whole breast itself can enlarge sometimes because she has a large breast cancer. The nodes, the axilla will look like a lump in the armpit. Then there's sometimes in the neck also she can have a nodal mass or nodal swelling. And sometimes they can have a nipple discharge, which is thin and watery, or sometimes blood stained. So if there is a nipple discharge, they must look for a mass and then report to the doctor. Then very rarely, when the mass is very big, you will have pain. This pain can be due to the mass, or because it involves the skin, there can be pain. Sometimes when the disease gets spread to other areas, they can have cough, breathlessness, and then sometimes back pain, pain in the vertebrals, that is backbone. Then sometimes headache and vomiting. Sometimes the hand swelling also will be there when the disease gets very advanced.
How can she lower her risk of developing breast cancer?
As I told you earlier, the risk of breast cancer is related to certain factors like having children before the age of 30 years, breastfeeding the babies for more than 6 months, maintaining an ideal weight, doing exercise for 30 minutes a day for 5 days in a week, and then you doing reducing the stress level by doing yoga or meditation, avoiding smoking, avoiding alcohol. All these things can reduce the personal factors for reducing the breast cancer risk. If you have a family history or if you have a genetic syndrome, you should go for a genetic counseling and find out what is the risk of developing breast cancer, and accordingly you can go for either screening, or sometimes you can reduce the risk by doing surgery like prophylactic mastectomy. Sometimes you have tablets also to reduce the risk of breast cancer, which can be taken for 5 years from the day from 35 years onwards. And then sometimes you can have removal of the ovaries also, which also reduces the risk of breast cancer.
What are the new screening guidelines of breast cancer?
The new screening guidelines are screening mammography from the age of 40 onwards. If someone is not willing to go through a mammography from 40 years onwards, then you can ask them to do from the age of 45. From 45 up to 54 years, annual mammogram. That is, every year you must do a mammogram. And after 55, if one wishes, can switch over to mammogram once in 2 years. Otherwise, they can do an annual mammogram. The other parts of screening are breast awareness and then clinical breast examination. Breast awareness is about a woman who tries to know how her breast feels and looks. So every day when she has a bath, she has to make sure that how the breast look normal or it feels normal. If there's any change in the breast feel, or if there's any change in the nodule or a mass, then they must report to a doctor. In that way, being breast aware, she will be able to detect the cancer much earlier. And similarly, having a clinical examination of the breast from the age of 20 onwards every 3 years, it will increase the risk, will increase the chances of identifying breast abnormalities at much earlier stage. So, important investigation or screening guideline is mammography, which will detect early breast cancer or subcentimetric breast cancer. And in the long run, it reduces the risk of dying due to breast cancer. Otherwise, the breast awareness and clinical breast examination does not reduce the risk of dying of breast cancer, but on the contrary, it increases the chance of detection of early breast cancers.
What is BSc and why it is essential?
BSE is breast self examination. In fact, to start with, the screening guideline was breast self examination, which is done once a month, fifth to seventh day of the menstrual cycle. A woman palpates her breast in a described pattern, standing in front of the mirror with the hands on the hip and also with the hands above held above the head to look for the size and shape of both the breast, to find out any changes in the size and the level of the nipple, and the skin looks normal. There's any changes in the armpit or in the neck where you can see swelling sometimes. So by doing so, you will be able to identify if there is any change in the breast or find out if there is a mass in the breast. If you find a lump or a mass in the breast, then you should go for an examination. So in a country like ours, where there is no recommended screening guideline for all women, what you can do is do a self-examination every month, and then you can detect if there is a mass. So breast self-examination results in detection of a breast cancer at a much smaller size. Sometimes this creates false positive results or false alarms where a woman thinks there is a mass, and you go see, do investigations, and there is no mass at all. So it results in false alarms. Second, unnecessary investigations, like sometimes you have to do a biopsy to rule out if there is a cancer or not. So breast self-examination as such is not recommended in screening guideline, but otherwise it is replaced by breast awareness in the breast screening guidelines now. So women should be aware of the breast, how it looks and feels, so that they'll be able to identify changes at a much earlier stage and to detect breast cancer at a much earlier stage.
What are the general treatments?
The general treatment is surgery, chemotherapy, and radiotherapy. The initial stages, that is, early stage cancers, are treated only with surgery. If the cancer is advanced, then we have to give chemotherapy and then you can operate. After surgery, in the early stages, then you should plan for chemotherapy. Most women will require chemotherapy. That is, chemotherapy is given in saline bottles and it's given over a period of few hours. Then every 2 or 3 weeks intervals for 6 to 8 cycles, depending on the condition or the stage of the disease. The doctor will explain to you how many cycles you need. But most women will require chemotherapy, except very elderly women, where you remove the cancer and they are hormone positive, where only hormonal tablets will be given for them. The third part is radiotherapy, which should be given for 5 weeks, 5 days in a week. And this radiotherapy prevents recurrence of breast cancer in the same area. Whenever the lady has a larger breast cancer or node positive breast cancer, radiotherapy will be required. And sometimes breast conservation surgery, where you remove only the tumor and leave the rest of the breast, then you will require radiotherapy. Once all treatment is over, hormonal therapy is a tablet which is given for 5 years, and this is given generally in patients who have ERPR, otherwise the hormone positive breast cancers, wherein this hormone tablets will be given initially for 5 years, and depending on the risk or high risk women will be given extra 5 years also.
Can breast cancer be prevented?
Yeah, women can prevent to a certain extent by leading a healthy lifestyle, that is, maintaining a healthy weight, and consuming a diet which is healthy, avoiding saturated fatty acids, and exercise for 30 minutes in a week, and then having children before 30 years of age, or breastfeeding the children for more than 6 months, which is considered to be protective. Then you're not using oral contraceptive pills for more than 5 years. And one should avoid hormone replacement therapy for more than 3 years in the menopausal age group. And avoiding stress by doing yoga and meditation all will reduce the risk of breast cancer. The other is where they have a genetic risk of developing breast cancer. They should go for a genetic counseling. This genetic counseling will assess and will tell them what is the risk of developing breast cancer and their chances of preventing it by doing some prophylactic surgeries like prophylactic mastectomy, that is removal of both the breasts after the age of 35, or removal of both the ovaries after the age of 35, or you should take some tablets to reduce the breast cancer after the age of 35. These are, and also regular screening programs from the age of 30. And this all in patients who have a genetic risk of developing breast cancer.
Thank you so much, Doctor, for upgrading us with such valuable knowledge and surely help in spreading awareness for breast cancer and will surely make women aware about how early detection of breast cancer.
Thank you.